first we should know what is the pantoprazole drug. So pantoprazole is a proton pump inhibitor. So in our stomach there are some pumps which regulates the secretion of acid. So in our stomach the proton pump is a very important pump. It secretes HCl in the stomach. So what does the pantoprazole does? Pantoprazole inhibits that proton pump, and after inhibition the acid level in our stomach decreases since it inhibits the proton pump. Okay. So where pantoprazole can be used? Pantoprazole can be used to treat erosive esophagitis from the okay. It can be used in erosive esophagitis. It can be used in GERD, and it can be used to treat Zollinger-Ellison syndrome. So let's see how pantoprazole works in our body. So here we can see that this is an H plus A plus ATPase form. So this is the last phase where the acid secretion happens in our stomach. The proton pumps inhibitors works on this pump, and it inhibits this pump so that the acid secretion in our stomach decreases. So where can we effectively use pump for? The pantoprazole can be effectively used in cases of ulceration and erosion of the mucosal lining of the stomach. Since it is a proton pump inhibitor, it will reduce the amount of gastric acid secretion in the stomach, thus alleviating the problems caused by high levels of acid in the stomach. Cases where POM40 can be used are GERD, esophagitis, acute gastritis, and NSAID-induced peptic ulcer. So we know that there are some NSAIDs like paracetamol, aspirin, where it causes erosions in our stomach wall if used in excess. So in cases of that, if increased amounts of HCl are released in the stomach, so it can cause irritation and more chances of peptic ulcer can occur. So we can use pantoprazole in these cases to reduce the effect of NSAID-induced peptic ulcer. Now, when should we take pantoprazole? Pantoprazole should be taken in an empty stomach in the early morning. In different cases, the doses of pantoprazole are different. Just like in GERD, we should take it one tablet once a day for 8 weeks. In peptic ulcer cases, we should take one tablet once a day for 8 weeks. For H. pylori infection, we know that peptic ulcer can be caused due to infections, which is caused by H. pylori. So we can use it 2 tablets once daily for 7 days, followed with 1 tablet until day 28. And we should use antibiotics with it, like metronidazole and clarithromycin. These drugs can be used with pantoprazole to effectively diminish the effect of H. pylori in our stomach. So what should we know before administering pantoprazole? It's not unknown to anyone that adverse effects will occur in any case of drugs. So we should use the drugs very judiciously, and in case of pantoprazole, it is the same too. So what are the side effects that can cause? We can classify the side effects of pantoprazole into 3 classes. These are the common effects, the rare side effects, and the long-term side effects. The common effects which can cause are nausea, vomiting, diarrhea. These are the very common side effects which can be caused in any cases of the drugs. The rare side effects are hepatitis, Stevens-Johnson syndrome, nephritis, and thrombocytopenia. Long-term side effects includes osteoporosis and hypomagnesemia. We know that drug interactions can occur with any drug. It is the same in case of pantoprazole too. So the drugs which we can't use with pantoprazole are clopidogrel, ketoconazole, fluconazole, these are antifungals, and methotrexate. So if we use these drugs along with pantoprazole, we know that pantoprazole decreases the level of acid in our body. So these drugs require an optimum level of pH in our body to act. So if we use pantoprazole in excess, so the optimum level of pH in our body will increase, in the stomach will increase. So these drugs won't work in those cases.
So what is the minimum pH balance that requires on that particular case?
You continue with the pantoprazole medication.
So we know that our normal level of pH in our body is 1.5 to 2. Okay, so we can use up to 2.5 to 3. If it becomes excess, then the optimum level of pH in our body will increase, in the stomach will increase. So in that case, these drugs won't